Gingival hyperplasias. First, fibroepithelial dysplasia. Second, inflammatory papillary hyperplasia. Third, epulis granulomatosa. Fourth is drug-induced gingival hyperplasia. Fifth is pyogenic granuloma. Sixth is peripheral ossifying fibroma. And peripheral giant cell granuloma. Fibroepithelial dysplasia. It includes fibroepithelial polyp and epulis fistulatum. Fibroepithelial polyp, it is the most common overgrowth in the oral cavity. It is found on the gingiva, so it can also be called fibrous epulis or gingival fibroma or focal gingival hyperplasia. It could ulcerate and it could also result from chronic irritation or maturation of a pyogenic granuloma. It is hyperkeratinized. Epulis fistulatum, it is a mass which is seen along the flange of the poorly fitted dentures, mostly on the facial aspect of alveolar ridge. The inflammatory papillary hyperplasia, also called denture papillomatosis, it is associated with chronic inflammation which is found under the ill-fitting dentures. It is also associated with candida. It is found in hard palate and alveolar ridges. Seen as multiple small nodules consisting of proliferation of fibrous tissue. Epulis granulomatosa, it is a hyperplastic growth of granulation tissue in a healing extraction socket. It is a reaction to bony sequestra in socket. So make sure that there is no granulation tissue left after the extraction to avoid this. Drug-induced gingival hyperplasia, it begins in the interdental area and progresses until the crown portion. It is more severe in the anterior region and it is associated with drugs like anticonvulsants like phenytoin, immunosuppressants like cyclosporin, and calcium channel blockers like nifedipine, verapamil. Pyogenic granuloma is rapid growing reactive proliferation of the endothelial cells. It is painless red or purple lesion, usually between the teeth. It can ulcerate and bleed easily. It is more commonly seen in kids, young adults, and pregnant women. It is called pregnancy tumor in pregnant women, which is not supposed to be treated. It will resolve on its own. Peripheral ossifying fibroma. It is exclusively seen in gingiva as gingival nodule, consisting of reactive hyperplasia of connective tissue. Peripheral giant cell granuloma is caused by trauma and overproduction of vascular cells and osteoclast. It is a soft tissue nodule composed of mononuclear and multinucleated giant cells.